Hi, this is Jonathan Martinez, and I am so pleased and honored to be with you today for our next video in our series on supported decision making. What we're going to talk about today is the next step, the next way that we can use supported decision making in the supports and services in the areas of life that we all need to use each and every day. Today is about money management, and that's an important step because in my opinion, and perhaps in yours, money management is one of the areas where people with disabilities are seen as not being able to make decisions at all. It's one of the last great divides for people with disabilities, is the ability and the opportunity to manage money. So let's talk about that. Let's talk about the importance of having control of the decisions in your life, like money management. And as we begin, that's our first principle, the same first principle we've had time and again. And that is this: self-determination is the key to a better life for people with disabilities. Self-determination, it's a fancy word, but really what it means is being in control of your life. People who are self-determined do more things. They make more decisions. They are the causal agents, the ones who make decisions instead of having decisions made for them. So when you hear me say, and you'll hear me say it a lot, that self-determination is the key to a better life for people with disabilities, I want you to think about people making decisions, people being in charge of their life, because that's what self-determination is. It's people exercising their fundamental right to make choices. And what we know from 40 years of research is that people with disabilities, particularly people with intellectual and developmental disabilities who are more self-determined, who make more choices, have better lives. We have study after study after study going back 4 decades, finding that people with disabilities who make more decisions, who are more self-determined, are more likely to live independently, to be parts of their community, to work, to be healthier and be safer. So how do we get to self-determination? How do we get to a place where we are the ones making decisions for ourselves? And that's what this whole series is about, is getting to self-determination using supported decision-making. There's a definition of supported decision-making up on your screen right now. People working with friends and family members and professionals to help them understand the situations and choices they face so they may make their own decisions. And that is an awfully fancy definition that I would prefer you would just forget. Because really what supported decision-making is this: getting the help to do the things you need to do and make the decisions you need to make, like all of us do every day. Each and every one of us, whether we have disabilities or not, use supported decision-making every day to make decisions, because we all get advice. We all seek out help when we need to make a decision. Think about all the cliches in our lives. Make an informed choice, get a second opinion, don't go off half-cocked. My dad's favorite statement: if you measure twice, you only have to cut once. They all mean the same thing. Get help, get information. And when people without disabilities do that, we don't call it supported decision-making, we just call it life. So to me, supported decision-making is doing what we all already do, just recognizing that people with disabilities can do the same things that we all can do. And here's what we know: that when people with disabilities use supported decision-making, like we all do, they have more self-determination. That's not rocket science, is it? If I am using supported decision-making to make more decisions instead of having someone else make decisions for me, I've got more control over my life. Well, what do we know what happens when you've got more self-determination, more control over your life? You have a better life. And that is what the research is showing, including research right here in Virginia. Just in 2021, we published the results of a study that was funded by the Virginia Board for People with Disabilities, where we worked with young adults with intellectual and developmental disabilities to help them use supported decision-making, to help them come up with their own supported decision-making plans with the help of their friends and family members and people they wanted to work with. Well, here's what we found out. Of the 10 people who we helped use supported decision-making, who went and made their plan and lived their life, and then we went and collected data with them, we interviewed them, we interviewed their family members and supporters, and here's what we found out. For all 10 of them, who were using supported decision making, all of them were showing more independence. All of them were more self-confident. All of them were getting better at making decisions. And according to their friends and family members, they made better decisions. And even in the middle of this pandemic, they had a better quality of life. They were doing more things. They had joined more groups. Why? They had more control over their life. One of them said, I never knew I could have a voice in my life. And for people who have been traditionally told they can't do things, to suddenly be empowered to make their own decisions is an incredibly powerful thing. And it shows the importance of self-determination and the impact of supported decision-making. So with that as an introduction, I want you to think about something else. I want you to think about being part of your community. When I say words like community integration, when I say words like independence, what do you think of? Are you thinking about just where you live? Because you're not, right? Being part of our community isn't just where we live. And if you think about the famous Olmsted decision, the one that said that people with disabilities had the rights to be full and fair and equal members of their communities, that didn't just mean you had a right to live in the community instead of an institution or a group home. Because if that's all it meant, if all community integration was that you didn't have to live in an institution and you could live in a supported apartment or a group home, but you didn't actually do anything with your time, what's the point? That's not community integration. Community integration is when we become parts of our community, when we become that full and equal member of our community. And how do we do that, and where do we do that? We do that when we're meeting our neighbors. We do that when we're shopping. We do that when we're part of our community, when we're taking part in community activities. So community integration is not just where you live, it's how you live. It's how you become part of the community in all the aspects of the community, including spending and managing your money, taking part in the financial sphere. Because think about how important money management is if you want to be full and independent or live a self-determined life. We all need money. It's a fact of life. We're always going to need money and to manage our money, to manage our housing needs, our food needs, for things like medical care, for things like transportation, and yes, recreation, because people with disabilities deserve the same opportunities to take a vacation or do things for fun just as everyone else does. And that's what we need to manage money for. So the fact of life is a fact throughout life. You simply cannot truly be full and equal members of your community without managing your money. And this is where supported decision-making comes in, because we all get help managing our money. We all get assistance and support when we have to make money decisions. We all have friends, family members, professionals, technology, people like accountants and lawyers who give us advice. Sometimes we watch TV where they give investment advice, where we learn how to manage our money. And that's a huge point. We spend our lives learning how to manage our money and getting help to do it. So people with disabilities, in order to be full and equal members of the community, should have the same opportunities. They should receive the same chances to learn how to manage their money as everyone else, and receive the same opportunities to manage their money to the maximum of their abilities. So to be self-determined, and this is the message of this entire webinar, to truly be self-determined and truly be part of your community, we have got to consider money management. And supported decision-making is a way to empower people with disabilities to manage their money to the maximum of their abilities, to do it just as well as they can, and to set up those supports and that help that they need that can empower them to do that. So let's talk about how we get there. The first place we can, or at least should, learn about decision-making and managing money outside of the home is school. And we've discussed in our second of this series, about supported decision-making and special education. And this is where I should say, if you want to see, if you haven't seen the other parts of this webinar, please do go to the PHC website and look through this webinar series, because the second one we did was on supported decision-making and special education. And there we talked about what the whole point of special education is. And that comes directly from the law. Up on your screen right now is a quote from the Individuals with Disabilities Education Act, which is the law that created the special education system. So when you ask, what's the point of special education, it's on your screen in bold letters. The whole point is to prepare students for further future education, employment, and independent living. That means independent living is a key component of special education that schools have to make sure they work with students on. So we have to have goals and objectives that address independent living. And where do we create those goals and objectives? An IEP meeting. I have heard truly horror stories about IEP meetings, but really what an IEP meeting should be, what the gold standard is a student-led process. That means from as young an age as possible. And if you're a parent, get your child to his or her IEP meeting as early as possible. If the child can only stay for a few minutes, so be it. As long as that student knows this is my team, you move forward from there. Because the point is, as the student gets older, as the student develops skills, the student takes on a greater leadership role in the IEP meeting. So that a student who, a 3-year-old can tell them his or her name. A 5-year-old can say what they like to do. A 7-year-old can say their favorite class. A 9-year-old can say what they want to be. And we try to address the students' specific needs as they get older with their specific abilities that they've developed. The idea being, as the student gets older, the student leads the team. 1 year, the student may introduce people. 2nd year, the student might talk about the agenda or walk through the process. But the point is that it should be a collaborative team. That by the time the student's 18, they should truly be working together to the maximum of their abilities. So that if the student has the ability to do this, the student truly leads the team, working with the team, giving the team information, the team giving the student information, so they can work together to create goals and objectives that address the student's specific abilities and needs to help the student achieve education, employment, and independent living. In other words, student works with the team works with the student. They work together to identify goals and objectives that the student can then agree to and sign off on his or her IEP. Doesn't that sound just like supported decision-making? Isn't that a student working with friends and family members and professionals to create this document that the student can make the decision to sign? Well, when we have those IEPs, they should include financial education, financial planning, financial management. That's because that's something we all have to do to live independently. So if you're a parent, I would be asking for goals that address financial planning and financial management. Why? Because we know that studies show that students who lead their IEP teams, students that develop their own goals, especially goals around self-determination, are going to be more successful both in and out of school. In other words, exercising supported decision-making in a safe environment like an IEP meeting can teach the student how to do it outside of school to create more self-determination and better quality of life, both in and after they leave high school. One way to do it is to create goals that specifically address these areas. If you watch the first webinar I did on go back to that first one. If you watch the first webinar I did on special education and supported decision making, you will find that we address what we call I statement goals. We talk about boring goals and how they don't really help students. Boring goals like the student shall use proper grammar 50% of the time. I know it's an important thing for composition and English studies, but it doesn't really teach anything. You either do it or you don't, you pass or you fail. So an I statement goal creates a way for the student to exercise self-determination and use supported decision-making. So instead of the student shall use proper grammar, I shall work with my teacher or my aide or whomever to develop stories about things I'm interested in and write them using proper grammar over 50% of the time. It's the same goal. It requires using proper grammar, but look what it does. It encourages self-determination. I must choose the stories. It encompasses supported decision-making because I must work with my teacher to develop those stories and make sure it has proper grammar. You know what happens if I don't use proper grammar? I got to work with my teacher more. I have to come up with different stories maybe, or write them in different ways. So the I statement, without ever using those words, self-determination or supported decision-making, brings both of those concepts to the fore. And we can do that with money management. Consider, again, a boring math goal. Learn your addition and subtraction tables. We've all been there, right? Trying to learn, what the 2 times table and the 3 times table and the 4 times table is. And instead of just being rote memorization, why can't we create an I statement that does the same thing, but also encompasses supported decision-making and money management? Look on your screen right now. I will improve my math skill by working with my teacher to create model budgets where I choose what to spend money on and add and subtract money to balance my budget. Each month, I will be able to manage and balance budgets with more money. Think about what that requires a student to do. They have to add money to their account. They have to subtract money from their account. They have to figure out how to make sure that works on a monthly basis, which means they have to use division. It's the same idea of learning your addition, subtraction, multiplication, division tables, only it encompasses things like money management. It's not a passive math problem. It's not passive memorization. It requires the student to be responsible, to make decisions about what's in the budget, what you're spending money on, how you're spending money. And sometimes that the knowledge that you don't have enough money to spend on what you want to spend. You have to make decisions about what to put in and what to take out. And because you're working with your teacher or whomever is in the goal, you're using supported decision-making. So an I statement goal like this one isn't just about math, even though it does accomplish the exact same math skills that a typical math goal does. It's not just about math. It also includes financial skills. It builds self-determination, and it lets the student use, practice, and hopefully master supported decision-making. And that kind of thing can follow the student throughout the student's career. Because when the student in Virginia hits 14, you have a new set of supports you are entitled to called transition services. Again, this is something we discussed in detail in the supported decision-making and special education webinar. But the short version is that transition services are designed to help the student plan for the rest of his or her life. I mean, school ends by the time you're around 21. Life goes till you're around 80, and you've got to have supports and services and skills all through your life. So that's what transition services are supposed to do. There's part of the definition of it on your screen. They're supposed to help the student move from school to what comes after, including things like independent living, community participation, and accessing adult services. Well, all of these are opportunities to incorporate money management, because again, what is more important when you're participating in a community than being part of the financial world, buying and spending and saving and managing your money, whether it be money from a job or money from Social Security benefits or something from a trust fund. You're going to have an opportunity to put your hands on money and figure out to some way what you're going to use it for. So as part of transition planning, shouldn't we be asking the school to help the student work on money management skills, independent living skills, community participation skills, like managing a bank account, like exploring financial aid or working and setting aside money for job expenses or budgeting, managing a budget, applying for Social Security benefits, and even things like managing your taxes and paying your taxes. These are the very definition of independent living and community participation skills. Therefore, my opinion, and I hope in yours, they should be part of the special education transition process, because the research supports doing exactly this. There was a national study called the Youth Transition Project that worked on improving students' self-determination, their community integration skills. And part of what they looked at was helping students develop money management skills. They put together a team, which sounds a lot like supported decision-making, to help them identify the supports and services they needed and put those into place, including financial and money management skills. Well, here's what they found is that roughly 2/3 of the students graduated with a high school diploma, which was way higher than the 43% average at the time. 2 years later, almost 3/4 of the former students were working, as compared to 46% of others nationwide. Why? Because their self-determination was focused on and enhanced. Things like money management and decision-making skills were focused on, which we know leads to greater self-determination, which we know leads to better life outcomes. And there are other opportunities than school, because like I told you, school ends. There are other supports and services after school where we can use supported decision-making to learn how to manage money. One of them is called vocational rehabilitation. In Virginia, the Vocational Rehabilitation, or VR, agency is called DARS, the Division of Aging and Rehabilitative Services. And what DARS is charged to do is help people with disabilities work. That's the whole point of the VR program, is that it is charged to help people with disabilities get what they need to prepare for a job, secure a job, retain, advance, or regain employment. In other words, if you need something to get ready to work, get a job, keep a job, advance in a job, or get a job back, VR, DARS in Virginia, is supposed to help you do that. So what if what you need to work are things like financial management skills? I mean, think about it. People need to manage their money when they work. They have to figure out how to budget for living expenses, for medical expenses. Sometimes they're going to need to be able to budget to make sure they don't overspend or over-earn and put their benefits in jeopardy. So VR is able to, and if it's needed, must help people make those types of financial decisions and get the support they need to do so. Remember, as we talked about in our third webinar in this series, vocational rehabilitation is a cooperative enterprise. You work with your VR counselor to help come to an agreement about supports and services, about job goals, about the things that you need. And when you do that, there is so much that VR can do, especially in the financial realm. On your screen are just some of the examples that, if VR agrees, they can provide supports and services to help you manage your money, manage your life, manage your work skills. Things like assessments to determine what you need, counseling to help you make the best possible decisions about things, assistive technology, education expenses, medical and mental health care, job coaches and transportations, and services to family members. These are all available to people with disabilities if they need them to work. Well, the same is true in the financial realm. What if I need counseling to make sure I'm not overspending my money? I'm not putting my job at risk by not having what I need to get there on time, not having the transportation I need to be able to get there, the funding for public transportation. That is something VR can provide, or assessments to determine what kind of financial support I need. All of these can be provided, and they're all done through what we call the informed choice process. Remember, VR is cooperative. So informed choice, this definition on your screen, is working with your counselor so that the counselor can give you information about your options, what might help you, what you might be interested in for a job and for supports and for services and for a provider. And what's supposed to happen then is that you work with your counselor works with you so that you can identify the job goal you want, the supports you need, and the providers who will provide them. And when you come to an agreement with VR on that, that is what you get. And doesn't that sound like supported decision-making? Working with a professional to understand your options so you can choose what you want to do. And it's time to take a short break when we talk about VR to answer a very important question, the one on your screen, because we're talking about work, and VR is all about work. You cannot get VR services unless you want to work. So should people with disabilities work if possible? The answer is absolutely yes. Work is not just making money. We know from studies that people with disabilities who work do far more than earn money. They are much more likely to have higher self-esteem and friends and an active social life. They're much more likely to be involved in their community. But still, I hear people in Virginia and all across the country say that they're afraid to work. And that's a smart fear, actually, because people who are receiving public benefits like SSI or SSDI, like Medicare, Medicaid, like food stamps, are not allowed to have more than $2,000 in money and assets to your name. If you have more than that amount, with very few exceptions, you can lose your benefits. So the very things that are keeping you healthy, the very things that allow you to live in the community, you can lose if you work. So of course, you have to ask the question, won't work make me lose my benefits? And that is where DARS, voc rehab, and supported decision-making come in. Because one of the supports that vocational rehabilitation, DARS in Virginia, can provide is called benefits counseling. Benefits counseling helps people with disabilities understand how much money they're earning, plan for how much they can earn, save and spend and budget and track your money so that you don't go over what many people call the fiscal cliff, over that $2,000 barrier where you might lose your benefits. So this is a chance to use supported decision-making, not only to help you work and find out the supports and services you need to work, but also to manage your benefits so that you can continue working and continue receiving your benefits. So using the informed choice process, which is just another way of saying supported decision-making, in my opinion, you can pick the supports and services that you need to get your job and to keep your job. And that can include benefits planning to make sure that you don't over-earn at your job and put your benefits at risk. And there are other supports and services you can receive to help you manage your money. One of them, you may have heard of a phrase called person-centered planning. That was covered in our fourth webinar where we talked about healthcare. But person-centered planning is what we see when people are receiving Medicaid waivers or receiving supports from Medicaid-funded entities like Centers for Independent Living or others. What person-centered planning is supposed to do is help a person make a life plan to decide on their supports and services in areas like employment and income and savings, healthcare and wellness, and community participation, to identify the supports and services that they need and that they want to have a community integrated life. And what person-centered planning is supposed to do is you're supposed to work with your counselor to help figure out what's important to you, what's important for you, where you are now, where you want to go, the things that you need and the things that you need to get to where you want to be, so that your counselor helps you understand the supports and services that you might need, helps you figure out who would be able to provide them so that you can choose the ones that you want. And doesn't that sound just like supported decision-making, where a professional is helping you understand your options so you can choose the one that you want? Here's just one example. If you are someone who needs to make a budget, if one of the things you need to do for your income and savings goal is budget, you can work with a case manager or others to help you make that budget using supported decision-making. Consider, let's say you've got a monthly income and you need to be able to manage it. There's things you have to spend on. There's things that you want to spend on. Supported decision-making can help you make a budget. There's a model budget on your screen. Let's say I've got a monthly budget of $900 and expenses of $400. It means I've got $500 I can spend or save. But there's a whole bunch of things I want to do that cost more than $500. Well, this is a perfect example to use supported decision-making as part of the person-centered planning process. You can work with people to understand which of these are things that you really need and which that you really want, to identify maybe lower cost available options or strategies. Like if you have a $200 budget for eating out, maybe you can find a place that's a little less expensive, or maybe just go out once a week rather than twice, or maybe go out every other week. That is a way to make decisions to manage the money that you have. And one of the things you can do through person-centered planning is get supports and services to manage your benefits. That benefits management and benefits counseling that's available from vocational rehabilitation is also available in person-centered planning. So through person-centered planning, we can use supported decision-making to manage our money, to identify possible things to spend on, ways to budget, to manage our benefits so that we can have the most community integration possible. And supported decision-making, money management follows us all through the rest of our lives. There are ways that we can set up supported decision-making systems to help us manage money. One way is through a power of attorney. Powers of attorney, which was discussed in the 4th webinar, essentially say, I give someone else the power to make certain decisions for me, but I can say how they're going to make them. So a power of attorney is very different, for example, than a guardianship, where the guardian is given the power to make decisions however he or she wants. With a power of attorney, I am telling the person who gets to make those decisions how to make them. So an example, language I've used, I'm saying I'm giving you the power to make certain decisions, but you will give primary consideration to what I want in the way you make those decisions. Let's give an example on financial authority and supported decision-making. The language you see on your screen came from a case I worked on with a young man who had an autism spectrum disorder. His mother was going to become his guardian because she felt that he couldn't manage money and might get swindled. And the young man actually said, you know what, I don't think I can manage money and I might get ripped off. So rather than guardianship, we came up with a plan to use supported decision-making and help this young man learn to manage money. The language right up on your screen. What we did was we put him on a budget. We said, you can spend X dollars a week. Just go nuts, learn how to make decisions, make good decisions, make bad decisions, figure out what it is to spend money. And that is a very easy thing to do these days. We can give preloaded debit cards, for example, where we put a limited amount on. But we also said, if you want to do something more than that, if you want to buy a car, for example, you can't do that without your mom's okay. She has to sign off. But look at the bottom of the screen in the bold letters. We said mom just doesn't get the right to say yes or no. Before she says yes or no, she has to have a conversation with the young man and give consideration to what he wants, to listen to his reasons for why he wants to spend that money. Why? He might be right. And if he's right, she should sign off. And he might be wrong. And if he's wrong, it's an opportunity for the mom to have a discussion with him about budgeting, about helping him figure out, if you want this car, you've got to figure out how to earn money to put away for a down payment and a monthly payment and gas and insurance. So maybe you need to get better supports and services. Maybe you need to go to DARS for vocational rehabilitation to get a better job so that you can earn that money. So it's not just mom saying yes or no. It's an opportunity to use support to help set up a system. And we can create other ones that we can do that with debit cards and credit cards. We can say, with checks, back when people used to write checks, a check for more than a certain amount must be countersigned by, in this case, the mother. He could write a check for up to a certain amount. Anything higher than that, the mom had to sign off on. But before she did, again, they had to have that conversation so that they can discuss what the young man wants and whether it's a good idea. And if it's not, they can discuss ways to build supports in to help the young man work toward what he wants, to figure out what he needs to get there. And that's why money management is so important, because it's about helping us get to where we want to go. You know, like this young man with this power of attorney, if he wanted to buy a car, well, he had to figure out what it means to do that, what it means to work, to earn the money, to save the money, so that he can not only buy it, but support that car. And that's where things get rough for people with disabilities. Because like I mentioned, benefits management before, it is hard to impossible for people with disabilities to live on Social Security benefits or Medicaid benefits. You know, like Forbes magazine said, people with disabilities simply can't have a good quality of life if all they're getting are benefits like SSI and SSDI. I mean, think about what people without disabilities, people who aren't on public benefits, can do. We can save money in bank accounts, in IRAs, in 401ks. We can save in medical savings accounts. We can create things like 529s to save for education. There's all kinds of ways for people who aren't on public benefits to save and manage their money. But if you're receiving that SSI, that SSDI, that Medicaid, that Medicare, you are stuck at the fiscal cliff. You can't have more than $2,000. In fact, if someone gives you money, if they give you what's called in-kind support, like free rent, that counts against your $2,000. So it's almost like you can't win, because you can't have money. And that goes back to what we talked about with DARS. Sometimes people are afraid to work because they're afraid they'll go over the fiscal cliff and they'll lose their benefits. So how can people with disabilities work and save money and actually have a life? How can you get to the point where people with disabilities can actually be part of their community? Because again, I say, you truly cannot be full and equal members of the community unless you're taking part in things in the community, like the economic world, like buying things, like spending and saving money. Well, there is a way to do it, and it's called ABLE. There is a relatively new law called the ABLE Act. ABLE stands for Achieving a Better Life Experience. The whole point of ABLE is to empower people on public benefits who wouldn't otherwise be able to save money to be able to save money. I mentioned a 529 account before. If you've ever heard of a 529 account, what it is you can put money away into a special account that grows tax-free and that you can withdraw without paying taxes to pay for education. Think of an ABLE account as a 529 for life, because it lets people with disabilities or someone on their behalf put up to $15,000 per year into an ABLE account. And then they can take that money out and use it for just about anything they want. And it doesn't count against their benefits. So you can make and you can save $15,000 a year without fear of going over that $2,000 fiscal cliff. And the money in the ABLE account grows tax-free and does not have any effect on your benefits. If you have less than $102,000, if you have $101,999 in your ABLE account, it has no impact on your benefits. If you have 102,000, it'll suspend your SSI, but you keep receiving Medicaid. In other words, you continue to get the things you need to live in the community while also having an opportunity to make and save and spend money so you can be part of your community. You are eligible for ABLE if you receive SSI or SSDI, or you would be eligible if you applied, but you haven't applied. In other words, if you would meet all the criteria for SSI eligibility, but you haven't applied for it, you can still open an ABLE account. There's lots of great information on ABLE at the ABLE National Resource Center, www.ablenrc.org. You can learn about every state's plan. Virginia actually is considered to have one of, if not the best ABLE plan in the country, but you can learn about it there, and you can learn about how to apply. You can learn about how to manage that money, because there are so many things you can use ABLE account money for. I mean, on your screen, there are so many tiny words. The reason those words are tiny is these are just some of the things that you can use ABLE account money for with no impact on benefits. You can pay rent, you can pay a mortgage, you can pay tuition for school. I'm talking preschool through college and vocational school. You can pay health insurance premiums. You can pay for equipment like glasses or wheelchairs. You can pay for transportation like bus fare or mass transit, or buying a car or modifying that car, and other necessary life things. Because people with disabilities have the right to the same life experience as everyone else. So clothing or recreation or vacation, and even once you pass, things like burial expenses. All of these can be used from an ABLE account. And I look at ABLE as a path forward. Remember, we talked about being afraid to work. Well, there is a way using ABLE to overcome and hopefully get well past that fear. I call it a path forward. And there was a young woman in Indiana who did exactly what I'm telling you about right now. She was afraid to work for fear of losing her benefits. So she opened an ABLE account. And she got her first job, which was a minimum wage job working at a hospital. And she put money away into her ABLE account while maintaining her benefits that she needed to live as healthy as possible. And then when she had enough money in the account, she took some out to get some job training, which helped her get a better job making more money, which she put in her ABLE account, with some of which she took out to get additional job training, to get additional supports, to get additional services to help her get a better job, which she made more money, which she could put in her ABLE account. And she followed that path. The last I heard of her, she was no longer on benefits because she didn't need them. She had worked and saved and trained her way to a full-time job with benefits. So she didn't need public benefits anymore. Is that going to work for everyone? No, but it's an opportunity. Anyone who meets the criteria can open an ABLE account and have money to have a life. You may have heard about a special needs trust before an ABLE account. The two work in many of the same ways. A special needs trust, same idea. You can put money away and it doesn't count against your benefits. And the difference is, though, and special needs trusts are fine in some instances. I have a godson who has a special needs trust because he is not able to manage money. He's not able to use an ABLE account either. So special needs trust is perfect for him. But there are differences between special needs trusts and ABLE accounts, one of which is that special needs trusts are taxable. And the second is that the trustee manages the money. That's the most important difference between a special needs trust and an ABLE account. In a special needs trust, if you want to take money out, you have to ask the trustee for permission. You pay the trustee to do that. In an ABLE account, the person who has the account, the person with disabilities, makes the decision on how to spend and save the money. It is the account holder who makes that decision. Excuse me. And that's huge because the whole point of the ABLE account is to support people with disabilities to be as independent as possible and have the best quality of life as possible. And that means ABLE accounts are a perfect time to use supported decision-making. ABLE accounts, when you apply, allow you to designate people who can have access to your account and what kind of access you want them to have. You can say, I want my mom, my brother, my sister to be able to watch my balance, and that's it. So that they see I'm overspending the account, they can come and work with me to make sure I balance my budget. Or I can give them power to put money in the account for me. I can even give them power to take money out of the account for me. It comes down to what I choose, because supported decision-making can help the person establish and manage account. Consider this example of a person I'm calling Jack. Now, Jack's got intellectual developmental disabilities, and he requires a lot of support through his whole life. But the fiscal cliff is going to keep him from ever having the money to do things with his life. So Jack's family can set up an ABLE account for him. You can even transfer money from another 529 account like education into an ABLE account. And then Jack and his family can use supported decision-making together to manage that account, to pick how, excuse me, to pick how to manage the money in the account, what to invest the money in. Jack and his family can use supported decision-making to decide how much authority he wants his supporters to have. Can they see the account? Can they add to it? Can they withdraw from it? Jack and his family can work together to help Jack manage the account, how to budget, how to deposit and withdraw, how much to withdraw, how to plan and budget for the future, and then how to use the money for the account. That's why supported decision-making is such a huge part of life and money management, because our goal is exactly to have Jack's life, working together to figure out how to budget, balance, and save and spend money for our lives. When we do that, we are exercising self-determination. When we use supported decision-making to make these money decisions as well as others, we are empowering ourselves to be self-determined. So that should be our goal. Everyone as self-determined as possible. Everyone as involved a part in their community as possible. Everyone making as much decisions, as many decisions as they can, with as much support as they need for things all through life. Education, employment, independent living, money management, all of the things we have talked about in this series can be done using supported decision-making, should be, if at all possible. It's been my honor to be with you today. I look forward to speaking with you again for the last in our series. Thank you so much.